everyone. Welcome to Convos with Care Crew. My name is Annie Solomon, and I am the owner of Care Crew Home Care based out of the Dallas-Fort Worth Metroplex in Texas. And I'm also a board certified nurse practitioner, have been for about 9 years now. So today we are going to focus on the heart. So for those of you who might not know, February is American Heart Month. So our goal this month is to be giving out some education and information to all of those in our community about how we can all try to work towards keeping our hearts healthy, and how our new specialty cardiac program might help some of the folks in our community suffering from some of these diagnoses to live as healthy as they can as well. So you might notice that Brittany is not joining me today. So I'm flying solo. Hopefully you guys will stay tuned to the end, and then keep your eyes out. We're hoping in the next week or two that we can add in an interview with one of our local experts in the cardiac field to give you a little bit more technical insight as well. I never worked in cardiology, so I wanted to make sure I brought in someone that had a little bit more to offer and to share, and a little different perspective for you guys. So stay tuned for that, but let's go ahead and jump on into it for today. So heart failure is a humongous issue. When I used to do house calls following up from the hospital with folks, it was a frequent diagnosis. And unfortunately, if we're not managing this disease appropriately and staying on top of things, it results in a lot of hospital admissions and readmissions. It costs the US about $30 billion a year in expenses between hospital trips, missed work, medication, all of those things. It's a huge burden on our healthcare system. It's about 5.7 million Americans are diagnosed currently with heart failure. And there's about 47% of all Americans have at least one major risk factor for heart disease. So this is something that could potentially affect half of our country if we don't get on top of it and really start to educate our community. So let's start with what exactly is heart failure. Heart failure does not mean your heart has stopped and you are dead, obviously, but our heart is a muscle, and it can start to fail over time for different reasons, whether that be from other diseases that are stressing the heart, like high blood pressure, high cholesterol, or atherosclerotic heart disease, where we're having plaque buildup, or whether it's a structural problem. Some folks have issues with their heart valves that separate the four chambers of our heart, and that can also lead to heart failure. There's multiple reasons, but the biggest thing is when we have the disease of heart failure going on, the heart is no longer pumping blood effectively and efficiently to the rest of your body. So unfortunately, you're not getting enough oxygen to all the parts of your body that need it. And a lot of times you'll also have fluid start to back up because that blood is not being pumped out of the heart at an effective rate. So we can start to see a lot of different symptoms start to arise from that. And it's kind of secondary to all of the different domino effects that kind of happens when the heart starts to fail. So common symptoms that we see in patients will be weight gain. Usually it's a rapid change in weight, 2 pounds in a day or 5 pounds in a week. We'll have an increase in fatigue or weakness because you're not getting oxygen to all of the parts of your body that need it. We might have some coughing or wheezing or trouble breathing or even shortness of breath. And a lot of times that is because we're not getting oxygen again to all the parts of our body, or we're having fluid that's backing up into the lungs because the heart is not pumping effectively. The biggest key too with all these symptoms is keeping track of them. So one thing that we actually have in our cardiac program is a log that will go in all of our patients' homes. That way, every day, our caregivers can make sure that we're checking what that client's weight is and having them jot it down in their log, marking down if they're having any of these symptoms. And if so, some more details about that. Jotting down the different things they're eating, details, because tracking these things is really going to help your healthcare provider to know how to best take care of you. So again, can be a variety of symptoms. Some people might present a little differently than others, but those are the main ones. And so the goals of treatment, once your doctor has determined that this is something that you have, that's usually based on their visit with you, their examination, talking about your symptoms, maybe draw some blood work. They might even do an echocardiogram where they're looking at your heart, measuring how much blood is being pumped out. That number is called an ejection fraction. They're going to kind of get an idea of where your heart is at. Once that diagnosis has been made, then the goals of your treatment is going to just be to keep that disease from progressing and getting worse, to making sure that we educate and empower you to try to improve your health, making sure you can stay active and complete your day-to-day activities that you need to do, and how to keep you independent and live the best quality of life possible. So that's usually done through a variety of things. Common treatments obviously are going to include medication. The medications will be tailored based on what the problems are that are going on. So obviously that's going to be discussed with your individual provider based on your circumstance. But there's common drugs that we use called diuretics, which will help to remove excess fluid from the body. Sometimes we'll use medications called beta blockers, which kind of slow the heart rate down and help to control the blood pressure. We also might use drugs called vasodilators. So those are going to help to open up the blood vessels and improve blood flow, help keep the blood pressure down and decrease the workload on the heart. We might also use medications, like even oxygen. Oxygen's a medication. We might allow someone to use extra oxygen that they can breathe in that will improve their oxygenation. So again, medications will be tailored to each person individually, but those are some classifications that we sometimes utilize in treatment of these patients. Other big thing is lifestyle changes. So we want to stop smoking. Smoking is obviously a huge risk factor. We all know it causes lots and lots of harm. That's going to be one huge thing, is if you are smoking, stop right as soon as you can, immediately. Reducing salt in your diet. We want to make sure we're not ingesting a lot of sodium that's going to cause fluid to build up in our bodies. We want to make sure we're eating healthy foods, drinking enough fluids, that we're following our fluid guidelines given to us by our providers, that we're reducing stress. Stress, obviously, we know stress can kill. We want people to try to eliminate as much stress as possible, getting a lot of rest, sleeping at night. We want to make sure you're getting adequate rest, that we're lowering our weight if possible. If obesity is an issue, that we're working towards that. I know it doesn't happen overnight, but trying to get our weight to as close to a healthy number as possible. We want to be working on that. And again, like we mentioned earlier, monitoring all of our vital information. So our daily weight, our blood pressure, and any symptoms that we might be experiencing. And then obviously, if things progress to a very severe level, there might be more interventions that your specialist might recommend to you, whether that's surgery, like a coronary artery bypass surgery, a heart valve replacement or repair if the valves are the issue. Sometimes people get implantable devices, or even very, extreme cases can even have ventricular assistive devices or VADs, which can help to keep your heart working until there's another solution, or a heart transplant. So that would obviously be the end result. not much more invasive that you can get than a transplant, but at times that might be something that becomes an option as well. So it can't be cured, unfortunately, but the more that we stay proactive, that we try to improve our lifestyle, that we try to remain as compliant with all of our providers' directions as possible, can at least help to slow down the progression of this disease and try to keep you as healthy as possible for as long as possible. So how can folks like us help? So, how can home care help? You might kind of wonder, well, it's a caregiver. How much are you going to be able to help? Well, our goal really is to help give you some comprehensive helping hands to make sure that we are keeping an eye on things. As heart failure can progress, it can be harder to do your day-to-day activities because you're short of breath, you're weak, your stamina and energy is not where it used to be. So those are all things that our staff can assist you with. They can also make sure that we're getting to doctors and providers appointments, that we're tracking your weight, your blood pressure, your symptoms, that we're taking medications correctly and on time, and that you're eating a healthy, balanced diet as much as possible. So all of these types of things can really help reduce the amount of hospital trips, ER visits, complications that can arise. And we actually have seen that. We have data to show that these interventions do lead to a reduction in hospital admissions, reduction in your healthcare spending, and an improvement in your life. I mean, we all want to try to live as long and healthy of a life as possible. So, these things all factor into that. So again, if there's anything that we can do to assist, don't hesitate to reach out. You can give us a call 24/7 at our office number at 817-242-4717. Or you can also go to our website at www.carecrewdfw.com, and you can look up more information about the services that we offer. Or perhaps we can connect you with one of our other community resources that might be appropriate for your needs at that point in time. So thank you guys so much if you stayed tuned throughout this video. I know it was a little bit technical, a little bit lengthy, but we'll be trying to continue getting you guys more and more information as the month goes on. So don't forget to keep an eye out on our social media. We're on Facebook, Instagram, and this will be on YouTube as well. And so if you have any questions, concerns, or if we can be of any assistance to you, don't hesitate to reach out. Again, I'm Annie Solomon with Care Crew Home Care, and thank you so much for joining us for Convos with Care Crew. See you next time. Bye.